stand up here today to tell you that the deficit for 0708 for mental health was actually $520,000 from a projected $2.5 million. And so that was really with the hard work of the mental health staff and the agency staff in general to manage the money and look at what we can do. We decreased our labor costs by 26%, and we decreased our operational costs in mental health by 14%. The $520,000 that we're over is really due to out-of-county placements. And what happened over the past year is that out-of-county placements increased by 30% for children and youth and increased by 23% for adults. So we know that we have a real problem. We're looking for alternatives, but this is really an area that we need to work on collectively and really look at not only regional models, but what we can do here. Of the $520,000, $345,000 was for out-of-county placement, and $175,000 was due to the interest that we owed. And at this time, I'd like to thank the board, and I'd especially like to thank the auditor, Meredith Ford, for forgiving the $175,000. So we actually balanced out a zero balance in mental health for 0708. So what we plan on doing for 0809 is we've actually transferred 21 positions that were mental health positions to social services. And by doing that, we're still able to maintain the mental health services, but those positions are now merit system, and we're able to draw down federal dollars. We're actually able to draw down $800,000 for 0809 for mental health services that we would not be able to do if we didn't have the agency formation. So, you know, I just want to say that it's been a long road. It's been a long year. And I have to say, all this year was really focused on the money. It was focused on the budget. And, you know, I think at times we moved faster than folks wanted us to, and we probably communicated slower than people wanted us to. But I think overall, for the end of 0708, we did pretty good with mental health. We're a little concerned about public health for 0809, particularly with the state budget still out. We're not quite sure what's going to happen. Our concern is that public health will be the next mental health, and we'll be looking at this for next year and the year after. We have our centralized administrative services, our fiscal accountability systems, our management practices, and so we'll continue to work on the edge, but at least we'll know that we're on the edge because we could measure. We are looking at other areas for 0809 as far as our budget for the agency. We are looking at selective hiring freezes, basically looking at the positions. Do we really need them? Can we keep additional positions vacant so that we can get to a zero balance at the end of the year? Also working with our community partners, looking at more subcontracting of services through our partnerships, looking at non-essential program reductions and other cost reductions and shift opportunities as we can. So that's all I have to say. Just wanted to give you the good news that we actually balanced out in mental health, and thank you for your support. We couldn't have done it without the agency integration. Thank you.
Thank you, Ms. Angela. There might be a question or two here, so Supervisor Delaware.
Thank you, Mr. Chairman. Ms. Angelo, this deficit in mental health has been on the books for a number of years, and we saw it go up and up and up each year rather than getting better. And you are, in the mental health staff and the agency staff, are to be commended for addressing that and bringing about the policies and the practices to get that down. And that was no easy feat, because like I said, it went, instead of going down for a number of years, it went up. And the whole challenge that you have had as the director and your management and other staff have had in continuing to bring the agency into being with the three divisions has been probably the understatement of the day. No easy feat, but you've done it, and the team has done it very well. And I just want to thank you for showing us that that decision of creating an agency out of those three departments was the right thing to do, especially as you stand there and say you're able to bring in federal funds to the tune of over $800,000 just because it's the integration. That gives me the confidence that we made the right decision when we decided to create the agency. And so thank you so much for your leadership and in the Health and Human Services Agency, and to your staff as well.
Thank you very much.
One more. Supervisor Pinches.
Carmel, you know, I guess it's probably easier to balance a budget, but the tough part is to balance a budget and still have the service delivery system out there. And you've been able to do it all. I could talk about certain things, but I'm just really glad you're here in Mendocino County. Thank you.
Thank you so much. Yeah.
And Supervisor Smith.
Thank you very much. Carmel, I too want to really thank you for taking on serious challenges. I think it was immediately when you arrived or shortly thereafter that you realized how complex and challenging it really was in terms of what you needed to do to address the deficits and be able to do the consolidation of services into the agency formation. And you really had to step into that role very quickly, and I think you've done an excellent job. The board heard from members of the animal welfare community that spoke, and we've gotten some emails. Could you just comment briefly on where the animal care and control budget, both for the coast and Ukiah, fits into this scenario, and make some comments from, based on what the community input is that folks have given us, that they don't want to see services cut. What are you having to do in that arena to curtail costs, and how does that fit within the bigger context?
Sure. It's really hard, as you know. You're sitting up here trying to decide, where do you put the money? Do you put it in emergency medical services? Do you put it in services around water? What do you do? And I think in public health we have the same problem, because clearly public health has been hit, not only with our own